Are you aware of the dangers and risks associated with oral sex? Some patients don't know or think oral sex isn't related to sexual intercourse. Watch this video to the end, and I'll explain all the diseases you could be exposed to. Let's dive into today's controversial topic. Many patients don't consider oral sex as exposure when doctors ask about their sex life. However, this is a misconception. Oral sex can indeed pose risks and dangers often unknown to those who practice it. Before we discuss the 5 main diseases linked to oral sex, let's clarify that the mouth and throat have a diverse bacterial environment, meaning bacteria naturally colonize our oral cavity. They're linked to digestion, to our digestive system. Normally, they don't overgrow, staying at usual levels in our natural flora. However, in disease states, these bacteria can multiply excessively. New germs can even appear in the mouth, like herpes or HPV. These pathogens are indeed linked to disease onset. Also, remember the urethra. The tube connecting the bladder to outside is sterile, free of bacteria and other germs or contaminants, and can be infected by this practice. Let's look at the 5 main diseases linked to fellatio. First, HPV, human papillomavirus. As we know, there are over 200 subtypes of HPV. Some are linked to oropharyngeal and penile cancers, as well as cervical cancer in women. These viruses can also cause benign lesions like genital warts. HPV in the mouth may go unnoticed, increasing risk for those engaging in unprotected oral sex. It can be a risk factor for ulcers or even malignant diseases like penile cancer. The second disease is oral candidiasis, also known as thrush. It's a fungal infection that can spread from the mouth to the penis, causing balanitis. These infections cause discomfort, redness, peeling, and burning in the penile area. Treatment involves antifungals, steroids, or topical antibiotics. The third disease is herpes. 2 herpes viruses prefer labial and genital mucosa. These are herpes simplex virus types 1 and 2. Normally, these viruses don't colonize the mouth. Oral herpes can spread to genitals through oral sex. Fourth and rarer is syphilis. Syphilis, a bacterial disease, rarely spreads via oral sex. The syphilis ulcer is quite distinctive, a painless sore on the glands or foreskin, raised edges, classically diagnosed by visual inspection. It needs treatment as it's a highly contagious disease. The 5th category is urethritis. Urethritis is inflammation of the urethra. It's characterized by redness, discomfort, and urethral discharge. Normally, as I mentioned, the urethra is sterile. It doesn't contain bacteria. The main germs causing urethritis are chlamydia and gonorrhea. They need a vector for transmission, often linked to unprotected oral sex. But how can we reduce these risks? To reduce oral sex risks, limit partners and know them well. If that's not possible, always use protection. You wouldn't share a toothbrush with a stranger, would you? However, some consider oral sex common, but it should be practiced responsibly and safely. Now, out of curiosity, comment below if you knew about the risks and exposure related to this practice, or if this was new information for you. If you found this video's content interesting and think it could help someone you know, share this info. Don't forget to subscribe to the channel. Turn on notifications to stay updated with our weekly content. Take care.